Leaders' questions.
Tanaiste, during the Minister Shatter's private member speech, he included information that his department had in relation to Rehab lottery cards. This was the first time that this was mentioned in the House, and we're all aware that there's a pending High Court case involving Rehab and the state. There is no doubt that this information is in the taxpayers' interest, and we all believe that there should be value for money. Tanaiste, in 2013, the Rehab Group received €2.5 million from the Exchequer in the charitable lottery scheme. This was down from €3.9 million the previous year. The group produces consolidated accounts that give combined activities of various business within the group, and there is no doubt that there should be more openness and transparency in relation to how the group spends their money, most of which is made from their business ventures that prioritises employing people with special needs. Now, Tanaiste, what is very confusing is the motivation behind the release of the information itself. Minister Shatter did this intentionally during his private member speech. So I suppose the key questions are, first of all, we have to be conscious of the fact that over 80,000 people use and rely on services provided by Rehab. 80,000 people throughout this country. 3,800 people are employed. But the key question is, what is the motivation behind Minister Shatter's intervention? What is the motivation behind the government's intervention? Are they concerned about misappropriation of funds? Are they concerned about the National Lottery and the matching funding? Or what is the actual motivation behind the continual spin with this regard? Is it concerns about individual salaries? Is there a broader concern about Rehab and how it operates? Or is this a motivation to do with the National Lottery scheme and matching funding that is provided for by the state? Or is there broader concerns in general?
Thank you, Deputy. Tanaiste.
Well, I think the first thing that has to be said is that whether we are talking about Rehab or CRC or any other charity, I think the first thing is to make it absolutely clear that the work that these organisations do is very important. The people who depend on their services value the work that they do, and I think that whatever approach we take or anything that we say, I think we should be careful that we do not undermine public confidence in charities or undermine the confidence that people have in making donations to them. I don't think you're correct in saying that it was the first time that the issue of the wind down of the lottery payments was raised in the House. My understanding is that it was raised at an Oireachtas committee by Rehab itself. I think the issue here is that where we're talking about the disbursement of public monies, there obviously has to be accountability for that. Under the charitable lottery scheme, which was established in 1997, the promoters of certain private charitable lotteries that have products similar to the products sold by the National Lottery have received annual payments from the state to supplement their income. The total annual funding available peaked in 2009 and 2010 at around €8.6 million. As the allocation of funding is based on gross ticket sales, the Rehab Group typically receives approximately 2/3 of the funding available each year. The scheme is now being wound down. A reduced total of €4 million was dispersed in 2013, and the allocation for 2014 is €2 million. I understand that the decision by the Minister for Justice and Equality to wind down the scheme was communicated to the relevant charities in October 2012. The scheme is being wound down over a 3-year period in order to afford affected organisations the opportunity to make any necessary changes to their fundraising activities to ensure that they are more directly profitable. It is not unreasonable that the state would examine how it spends public money supporting charities. Between 2011 and 2013, Rehab received €10.4 million in public money for its lotteries. If it is the case that the state is spending several million a year to support fundraising in the tens of thousands, then it might be better to consider whether those millions could be used elsewhere in frontline services, for example.
Deputy Keller.
Tanaiste, you see, the key question here is that matching funding is provided in the context of the National Lottery Scheme for charities. That is something that's been a common practice for many years. Many organisations receive matching funding if they're voluntary organisations or charitable organisations. Sporting clubs across this country receive matching funding in the context of other schemes. So this is not unusual. But what I find amazing is that the Taoiseach is running out of adjectives to describe his shock that he's had this information unearthed, when this information was freely available in the Department of Justice for many years with regard to the amount of ticket sales that were sold on an annual basis. And the idea that, or the implication, that the matching funding is in some way being misappropriated is almost the intention, the speak that's coming from government. So what I'd like to know is, what is the concern? What is the concern of the government? What is the concern of the Minister for Justice when he came into this House? And even though the state is in the High Court with Rehab with regard to compensation being sought by Rehab, it was a very unusual intervention, to say the very least. And the implication that this information was unearthed is simply not the case when it sits inside the Department of Justice year on year. So the key questions I ask again, Tanaiste, is what is the concern of the government and the Minister for Justice with regard to the funding, the matching funding being provided? Is there concerns that there's a misappropriation of funding, or is it just a concern that there's not enough openness and transparency? Because in the meantime, Tanaiste, in the meantime, when this spin is going on from government, it is doing untold damage to families, the linked and bred of this country, that are providing on rehab services and other charitable organisations to supplement what the state should be doing. And that's effectively the case here.
Thank you. Please resume your seat. Thank you.
Openness and transparency on your side as well as on the side of Rehab.
I'd remind deputies, this is leaders' questions, and we put questions, not make statements. Thank you.
Well, first of all, this is not particularly new. The arrangement whereby state funding was provided to certain organisations that were running lotteries, the decision to wind that funding down over a 3-year period, that was communicated to the organisations back in 2012. It is being done over a 3-year period. As I said, at the peak in 2009-2010, we were talking about 8.6 million euros in total, which was being paid to these organisations. And it was decided to wind that down over a 3-year period to give the organisations the opportunity to, make other arrangements and other fundraising arrangements and so on. And that has been ongoing now for some time. So there's nothing new in that. And Minister for Justice, in the course of the debate here in the Dáil the other evening, drew attention to what was happening in that area. At a wider level, what we have to do is, I think we have to ensure that the controversies that have arisen around some charities over recent times do not undermine, first of all, the very important work that those organisations do and the services that they deliver. In many cases, service that they deliver on the basis of payments that are provided for the state. And secondly, that it doesn't undermine public confidence in them. And that is why we brought in legislation to provide for a charities regulator. That's why we're proceeding with the putting in place of that regulatory regime. And it's the Minister's intention that will be in place, we hope, by the end of February.
Thank you. Deputy O'Snellick.
Tanaiste, today we're seeing again the lack of regulation of charities in this state and the untold damage that the revelations are doing to both the charities themselves but also to the citizens who depend on them. Your government has refused for 3 years to implement the Charities Act 2009, and again last night you voted against the Sinn Féin bill which would have resulted in its implementation forthwith. Ongoing revelations of excessive pay to charity CEOs, serious questions over fundraising and a lack of transparency and accountability have deeply angered citizens, particularly those suffering at the end of the brutal austerity cuts in recent years. What has been uncovered at CRC, Irish Water, Poolbeg and elsewhere is, I believe, a toxic political culture of top-ups, bonuses, jobs for the boys and contracts for the elite. And again, we read today of a former CEO of Rehab a long-term advisor of Fine Gael, billing the company for services, consultancy services, using a dissolved company. That all suggests kind of something wrong in the state of Denmark. And we've seen, for instance, the fact that CRC had very close links with the Fianna Fáil party. Taoiseach, questions is, do you think that it is appropriate that the head of a charity and a charity earns more than the Taoiseach of the country, and in fact earns 10 times more or maybe 20 times more than those who are on social welfare? Do you agree that the CEO of Rehab should reveal her salary? And further, do you agree with the call from the Public Accounts Committee that such charitable organisations should make full disclosure on such matters?
Thank you. Tanaiste.
Well, first of all, this is the government that is actually implementing the Charities Act and that is establishing a charities regulatory authority, precisely so that public confidence can be ensured in charitable organisations. The Minister for Justice and Equality got sanction from the Minister for Public Expenditure and Reform in December to proceed with the filling of the post of the Chief Executive Officer of the new Charities Regulatory Authority and a number of other administrative posts from within existing resources by the end of February. With regard to the board of the new authority, the Minister is issuing a call for expressions of interest from suitably qualified persons who wish to be considered for appointment with a view to having these positions filled by Easter. This will enable the authority to proceed with the preparatory work necessary ahead of its formal establishment by ministerial order later in the year. The focus of the new authority in its early phase of operation will be on the preparation of a statutory register of charities for publication. This move represents an important part of the work that we're doing in government to rebuild trust and confidence in our charity sector. I believe that the charity sector itself can show leadership in this area through demonstrating good governance and transparency in their own operations. I think it is important that we do underline again the good work that charitable organisations are doing. I think it is important that the public can have confidence that when they make a donation to a charitable organisation, that donation is going for the purpose for which it is made and that it is going into the services. That's why we will have a regulatory system in place, a regulatory authority for charities. As I've said, the key posts, the intention is that they will be filled by the end of February and that the board, the authority itself, will be done by Easter. So that work is proceeding. There is going to be a regulatory regime. With regard to the issue of transparency, I'm in favour of transparency. And I'm in favour of organisations making known in their accounts, for example, the salaries that they pay to their chief executives. And to be frank with you, I don't see any reason why salaries paid to chief executives or senior people in charitable organisations or other bodies should not be made available by way of public information.
The root of the issue here is the chaotic mix of public, private and charitable provision of health services in this state, and this has been allowed to develop over successive governments, including previous governments that you yourself have been involved in. This has allowed charitable organisations to provide core health services, and those governments and yourselves must bear significant responsibility for the current situation. While the state has provided much of the funding, an arm's-length relationship allowed poor accountability to flourish, and we've seen the situation in St Vincent's Hospital, where you have the same chief executive for both the public and the private hospitals, and all that we've heard. Tanaiste, do you agree that, considering the amount of public money that has gone to support the activities of Rehab, that it would be more cost-effective for those services, the services it provides at the moment, to be provided directly, as it should be, by the state?
Tanaiste.
Well, first of all, I think let's be clear about this. This is the government that is getting to grips for the first time with what is happening in organisations which are funded by the state and where issues have arisen in relation to salaries that are paid or issues in relation to governance. It was this government that in the first instance commenced the audit through the HSE of the various organisations which are funded by the state, and it was that audit which shone light on the levels of salaries and various arrangements that are being made. Secondly, in relation to the charitable organisations themselves, we are putting in place the regulatory regime that I have described, and progress is being made on that, the relevant staff being in place by end of February, the authority itself being in place by Easter. And that will be the first time that will have been done. In relation to the spending of any public money, it is the government's view that there has to be accountability for that spending. It has to represent value for money, and it has to represent the best outcome as far as the taxpayer is concerned. If at any point we feel that public monies can be better used or can be more effectively deployed or can deliver a better service for the public by means other than channeling that money through particular organisations, then that is obviously something that will inform policy decisions that we will take. But what is guiding our view here is, first of all, that the public gets the best possible service for the spending of any public money, irrespective of how it is spent, whether it's through a state agency or a voluntary agency or a charity. And secondly, that there is transparency around the way in which the taxpayers' money is spent. That's why we have taken the approach that we have taken, and we're going to continue with that until there is a satisfactory outcome to all of these matters.
Thank you. Deputy Donnelly.
Thank you, Ken Corlett. Tanaiste, as part of the recent reconfiguration of Dublin hospitals, the emergency department at Loughlinstown was downgraded to a minor injuries unit and 24-hour care was stopped. Now, I and many others supported these changes because the clinicians leading the reconfiguration believed unanimously that it would save lives. The HSE gave us repeated assurances that St Vincent's would be given sufficient resources to absorb the extra workload from Loughlinstown Hospital. But Tanaiste, in spite of these assurances, the following letter appeared in the Irish Times from a registrar in St Vincent's. The real scandal at St Vincent's is the overwhelming increase in acute unwell patient volume since the effective closure of Loughlinstown to out-of-hours admissions. This has led to a doubling of medical and surgical admissions to an already stretched but otherwise efficient and well-run public hospitals. Clinicians of all grades and disciplines are working flat out to cope with the increased demand. So, Tanaiste, I followed up with clinicians in St Vincent's, and here's some of the things they said. They said ambulance arrivals are up about 50%, GP referrals to the emergency department are up about 50%, and overall admissions are up about 50%, and Tanaiste have doubled, they tell me, now and out of hours. They say that in spite of this, the emergency department has received no additional nurses and only a token complement of doctors. Just last week, Tanaiste, staff that were promised from Loughlinstown to St Vincent's have been pulled. So the emergency department in Loughlinstown is dealing with a 50% increase in volume with only a handful of extra medics, contrary to the assurances we were all given. That's not the only problem. St Vincent's hasn't been given the additional ward beds to deal with the additional volume either. Also, patients in Loughlinstown who get very sick are being referred directly to the ICU, the intensive care unit in St Vincent's, which is also bringing that to overcapacity according to the medical staff in the hospital. So not only is the emergency department working flat out, Tanaiste, but there's nowhere in the hospital for them to send the patients once they've stabilised them.
Thank you.
So what's the result? The end of the letter says this: the end result is an unsustainable, overcrowded and unsafe mess with significant compromise in delivery of care. Patients are suffering and some will die. But Tanaiste, this is outrageous.
Thank you, Deputy.
It's unacceptable to me, and I've no doubt it's unacceptable to you that this has happened. So my question is this: why have the additional resources, which we were promised would be put in place, not been put in place? And why has a situation been allowed to develop in St Vincent's Hospital in which clinicians in the hospital are now telling us is going to lead to patients in your constituency, in my constituency and many other places dying?
Thank you. Tanaiste.
Well, Deputy Donnelly, as you're aware, prior to these changes taking place, between Loughlinstown Hospital and St Vincent's Hospital, I convened a number of meetings with the HSE and with the management of the two hospitals. And I invited you, as I did other deputies who had expressed to me an interest in this issue, because you didn't express any interest to me on the issue. You know, Deputy Boyd Barrett, your only interest. Your only interest, Deputy Boyd Barrett, is to stand outside the hospital with the picket. You have no interest. You have no interest. You have no interest whatever in solving the problem.
Thank you.
We have, as you know, Deputy Donnelly, we convened those meetings to discuss with the managements of the HSE and of the hospital their plans in relation to these issues. I will arrange another meeting now, arising from what you've just read out here, and ask the managements of St Vincent's Hospital and Loughlinstown Hospital and the HSE to address the issues that you have raised here this morning, because, like you, I would share your concern if the service is not being adequately delivered. I'm a little surprised at the figure of an increase of 50% in ambulances, because, of course, prior to the changes in Loughlinstown, trauma cases for about a period of 2 years or more, in any event, had been going directly to St Vincent's Hospital. But these are issues that certainly I take seriously, and I'll ask the HSE and the hospital managements to meet with me again and discuss those issues.
Deputy Donnelly, 1 minute. Thank you.
Thank you, Tanaiste. Tanaiste, can I suggest to you, I appreciate your offer of setting up a meeting. Can I suggest that a meeting is probably not enough? Can I suggest at this stage, we've been given many assurances. We were given an assurance, I was given an assurance by the HSE that the combined budgets of the 3 hospitals involved, St Vincent's, Loughlinstown and St Michael's, would increase as part of the reconfiguration. I was then told a year later that actually not only would the budget not increase, it would decrease. We were given an awful lot of assurances around timing of when this would happen. Those assurances didn't come to pass. And now we have this extremely serious situation where a medical registrar and medical staff are saying people are going to die, and they are telling us that the assurances we have been given by the HSE
Could I have your supplementary question,
been met.
please?
So, Tanaiste, can I suggest to you that a meeting is fine, but actually at this point, because these allegations are so serious, we need an independent and urgent review. Is the 50% correct? I don't know. Is ICU over capacity? I don't know. Are GPs referring? Is there a doubling of admissions out of hours? I don't know. We don't know. But what I think we need at this stage is an urgent independent review. So could I ask 2 things? As well as the meeting, which I thank you for offering, will you ask that an independent review is immediately commissioned and that we can get a report back on that? And will you commit that if this review finds that these allegations have substance and that the necessary resources have not been provided to St Vincent's, that this government will immediately provide them? Thank you.
Thank you.
Well, I think the first thing we have to do is to probe the facts and see what is the actual factual situation. I think maybe it might be a good idea to ask the registrar concerned to come and tell us directly and have the issue probed, the statements that he's making, with the management of the hospitals. So I think the first thing we have to do is to establish what is the factual position, and then we'll set about resolving it. I think what we need, the outcome we want here, is that there is the highest level of service available to the public. You mentioned beds, for example. My understanding was that beds in Loughlinstown Hospital were to be used for elective situations and so on, which would in turn free up beds in St Vincent's, which would enable, the throughput of people through the accident and emergency service. You're aware that by the time the changes were made in Loughlinstown, the numbers actually attending at the accident and emergency ward in Loughlinstown were very, very small at night, because by that stage, most of for quite some time, the major, if there was an accident, for example, on the N11 somewhere, the accident case was brought directly to St Vincent's Hospital. So I'd like to probe the facts here a little to see what is the factual situation. We can do that, and if necessary, as I said, we can ask the registrar who has written about these matters to come and give us the information he has, and let's have it tested.
Thank you. That completes Leaders' questions for today. We now move